It's great to be joined today by Urologist Dr. Aaron Spitz, who is a national expert on men's health, as well as male sexual functioning, male fertility. It's so great to speak to you, Dr. Spitz. I think our audience is going to enjoy this, or at least hopefully get something useful out of it. We collected questions related to men's health and men's sexual health over the last few days. And one question that comes in very frequently, and this may be because of the age of many in our audience, sort of in their 30s, is when do you really need to start getting prostate exams as a man? And this is a very sort of hopeful question. Is there a less invasive version maybe on the horizon, some kind of imaging that might replace the digital test that is now done?
Okay. No, those are really important questions. What we currently are recommending is that for most men, they should start checking at age 50. However, if they are African American or they have a strong family history of prostate cancer, it would make sense to start checking at age 40. And the check is this digital exam, and digital sounds a little misleading because it's not a computer.
Right.
It's digit, the finger. And right now, there is not a better imaging substitute for that is reasonable. For example, we are working on MRI imaging of the prostate as a way to evaluate if a cancer is present or not. But that's very impractical to try to use an MRI, which is an hour-long study at great expense, to replace really what's just a moment of inconvenience with the digital exam. And the MRI is not yet foolproof either. But it's not just a digital exam, it's a digital exam plus a PSA blood test. The PSA blood test has gotten a lot of bad press, but in a experienced doctor's practice who knows how to interpret the test and has examined many men, it's a very useful test and it has saved many, many lives. So again, it's the combination of the digital exam and a PSA blood test starting at age 50 for most men, starting at age 40 for men with high risk of prostate cancer because of a strong family history or because of being African American. And these tests are typically done yearly. There's some subtleties which may allow a person to get it every other year, but that's a little bit more involved in the discussion, but suffice it to say, those are the guidelines.
Okay, now when it comes to a condition like prostate cancer or other prostate-related conditions, whenever we talk about cancer rates, we always want to keep in mind if we hear that a rate has gone up, has it actually gone up, or are we now categorizing some of these diagnoses differently, or are we better at diagnosing conditions? So bearing all of that in mind, what is the data as you understand it regarding whether the actual incidence of prostate cancer and prostate-related issues have increased?
I believe that what we're seeing is that when the PSA blood test first came out, we saw a big increase in the number of prostate cancers that were being detected, but that wasn't necessarily that the incidence had increased. It was we had a new way of detecting it earlier. That's all settled out. And now the PSA blood test is allowing us to pick up and understand what the incidence of prostate cancer is. And the incidence is about 1 in 4 men over the course of their lifetime. That's a real incidence, and prostate cancer is a very prevalent problem amongst men. Now, I'll tell you something interesting in that the incidence of prostate cancer seems to vary in different populations around the world. And it seems that in the more modern industrialized populations, whose diet is quite a bit different from, say, rural, more agrarian populations, there does seem to be a higher incidence. So, for example, the populations in, say, rural China have a lower incidence of prostate cancer than the population, say, in more urban setting like Hawaii. And when Asians move from rural China to Hawaii, their children who are genetically similar have a much higher incidence of prostate cancer, probably from this different environment and probably related in many ways to the diet. So the incidence of prostate cancer is rising as we become more industrialized and as our diet shifts. However, the incidence is not just inherently rising.
On this program, to shift gears a little bit, we often deal with issues of religion and the way that religion seeks to influence either culture or government, etc. And a question that came up frequently from our audience, I think from people who expect the answer to be one or another, and we'll give you the opportunity to answer in the way you see fit, there's often religious opposition to masturbation, based strictly on medicine and evidence-based analyses. Are there any negative health repercussions to male masturbation?
There are no negative health repercussions to male masturbation, but masturbation is really like most things in life. If it is taken to an extreme, then it can be harmful, not in a physiological way, but more in a behavioral way. So at its extremes, there are individuals who masturbate in a particular way with a particular compulsion that ultimately interferes with their ability to be able to have satisfactory sex or reach climax, or therefore even be able to ejaculate for the purposes of conception with a female partner with vaginal intercourse. And that, again, is an extreme example. But otherwise, masturbation has no true physiologic health impact in any negative way. It's a typically a normal human experience.
I want to talk a little bit about the relationship between the sort of complaints that a urologist like you may hear from patients and the interplay with sort of psychological or psychosomatic conditions. And I want to sort of present two to you, and you can take them separately or together, however you see fit. One is erectile dysfunction, and we know about the huge sort of pharmaceutical industrial complex that is developed around pills to treat erectile dysfunction. And I'd be interested to hear from you, in your medical experience, the connection between that condition and sort of psychological or psychosomatic elements, and also frequent urination, which is a condition that often is increasingly coming up in books about conditions like headaches, irritable bowel syndrome, etc., which often are sort of diagnosed amorphously, not always associated with a specific cause, that some in the medical community believe can be actually reflections of sort of emotional or psychological distress, for example. What's your sense of that?
Well, I think that the psychological components of both of those conditions are much more relevant in a younger population, like your viewers, for example. However, with regards to erectile dysfunction, the medical community suffered for many years from the false notion that most of it was psychological, and it really relegated most of the patients suffering from erectile dysfunction to no real remedy. It is very much age-related when you're looking at both of these conditions. And let's look at erectile dysfunction first, and then we'll take frequent urination.
Yeah.
Erectile dysfunction is most commonly experienced by men in the later decades, starting in, say, the 50s, 60s, 70s, and beyond. And with each passing decade, the percent chance that a man will experience that gets higher. So, for example, about 50% of 50-year-olds will experience it, 60% of 60-year-olds, 80% of 80-year-olds, you get the idea. And for the vast majority of men in that age group, it is physical, not psychological. Now, certainly it can have a psychological feedback, and then you can set up a loop that makes it even worse. But the underlying physical component is typically a problem with the blood flow to the penis, because an erection is basically blood flowing into the penis, expanding it, filling it, getting trapped in there, and then making it firmer and firmer, kind of like pumping up a tire. And you have to have healthy blood vessels, nerves, hormones, neurotransmitters. All of those things have to be functioning and coordinating well. And as men get older, there is a deterioration in any number of those systems. Throw in some diabetes, throw in some high blood pressure, and understand that the arteries that supply the blood to the penis are already very narrow to begin with, significantly smaller than the arteries to our heart. And as you know, men in their 50s, 60s, 70s, 80s suffer from clogging of the arteries to the heart, clogging of the arteries to the brain. Again, much larger arteries, and heart attack and stroke are common. We know that's not psychological. So it is a physical condition, and these pills do increase the flow of blood to the penis for these men, and they work for many of these men. But in the younger population, men in their 20s and 30s, it is usually psychological or behavioral, and it can be very simple and very subtle. See, adrenaline, which our body releases in order just to maintain our resting blood pressure, gets released in surges when we are faced with danger or when we are anxious. And what adrenaline does is it increases the blood flow to our heart and lungs, gets us ready to deal with something, but it decreases the blood flow to the less vital parts of our body, which might be our fingers, our toes, and our penis. So when a man experiences some trigger to the adrenaline, some anxiety, and it may be something as simple and subtle as, I wonder if I'm going to have trouble getting an erection like I did last time. Just a simple thought like that alone can cause his body to release adrenaline, which then decreases the flow of blood to his penis and prevents him from getting an erection or from maintaining an erection. Now, it could be a much more complex psychological trigger, but it can be a trigger just as simple as that. And even understanding that may help, but that can be a hard thing to tell yourself not to think about. When you tell yourself not to think about something, then all you do is perseverate on it.
Yeah.
And even in the psychological conditions, these pills, which increase the flow of blood to the penis, can overcome the adrenaline effect. The adrenaline is trying to close the blood vessels. These pills keep the blood vessels open. And these pills can be helpful in the psychological cases of sort of getting somebody back to their old self, dusting themselves off, having some positive reinforcement, having less of that adrenaline release associated with the context of about to have sex, and sort of get back to normal. But certainly, behavioral medical approaches to these patients is extremely valuable, even to the patients that have an underlying physical, because the psychological component is also going to come into play. They're going to have anxiety about their inability to have erections, even if they're older and it's physiologic, and that's going to reinforce the problem. So I think that there's certainly a very important role for the behavioral approach, for the psychological approach, but particularly in the younger population.
Okay, a few other quick, oh, I'm sorry, go ahead. Yeah, did you want to comment on frequent urination?
Yes, I want to comment on frequent urination. So, like erectile dysfunction, as men get older, they also have a physiological tendency to have increased urination. And there's two reasons for that. One is the prostate gland, which is like a tunnel that surrounds the urethra as it goes from the bladder into the penis part of the urethra. It grows as we get older, and it squeezes inward, and it decreases the flow. And when the flow decreases, the bladder, which is a muscle under its own autonomic control, it's not a muscle that you can consciously control like your biceps, for example. That muscle has to squeeze harder and harder. It gets thicker, less compliant, can't hold as much, goes on a hair trigger spastic type mode, and wants to empty urine more frequently, even though it's not filling up as much. And that's a physiological situation in older men. In younger men, yes, there can be a behavioral component, stress or some sort of behavioral issue during their childhood and how they were urinating. But these are rare. It's really rare that it is a behavioral phenomenon. If a young person is having frequent urination, you really got to rule out real physiological causes first. And that could be a stricture of the urethra from a previous sexual transmitted disease or a previous injury or previous urinary tract infection, or a prostatitis, an infection or inflammation of the prostate, or a sexually transmitted disease that's untreated. Or I have seen men who, even though their prostate is not enlarged, just the way their anatomy works is dysfunctional and their bladder neck is closing off too much. And it's a real condition, not psychological. So it is important to rule out the physiological infrequent urination. And for the vast majority of older men, men whose prostates are getting large, these pills really work. They relax the opening of the urethra right where it comes off of the bladder, where the prostate's around it, and they open things up, let the urine flow more easily, and the bladder calms down. So the pills are very helpful in the majority of these cases.
A few quick ones in the limited time we have left. Laptop on your lap, rumors about this reducing sperm count from the heat. Anything to that?
Well, there may be. There have been scientific studies that show that heat deteriorates sperm production, We know for sure that it deteriorates sperm production in certain occupations where there's a significant amount of heat. Firemen, welders. But whether or not people who have laptops on their laps actually have verifiable lower birth rates has not been established. But I would say for anybody who is struggling with achieving a pregnancy, who is keeping a laptop on their lap for long durations of time, get it off. Why not decrease in insult? Because we know that heat is a factor. That's why our testicles, for us guys, are in our scrotum and not in our abdomen like women's ovaries, because they actually require to be a couple degrees cooler than body temperature. And if you're going to be placing heat directly on them, that sort of is, short-circuiting that. That's also why getting in a jacuzzi is not a good idea if you're trying to establish a pregnancy, because that immersive heat doesn't allow the testicles to cool themselves down. We do have mechanisms to keep our testicles cool, even if it gets hot outside, or even if we're exposed to heat temporarily, our scrotums get slack and it drops our testicles further away from our body in warm weather or warm water. When it's cold, our scrotum contracts and pulls them closer to our warmer body. So we have mechanisms, but when you put a source of heat on top of them, or you immerse yourself in a source of heat, you sort of bypass that mechanism. There's also been some notion that EMF waves from cell phones or from electrical equipment might impair our fertility. And there have been studies that shown that sperm in a dish next to cell phone signals do show some decline, but whether that actually translates to lower live birth rates has not been determined.
Last question, real quick. I'm fascinated by scams. Is any pill, pump, or other device going to actually enlarge the size of a man's penis, no matter what you read in the back pages of a magazine?
Right. So that's the question I get asked most commonly by my friends. There are no pills that will enlarge the baseline size of your penis. The claims they make for making your penis larger is simply that they're inducing an erection. And yeah, your penis gets larger when it's erect. And some of these pills actually work by spiking their formula with Viagra or Cialis, and that's why they work so well. As far as actually making the resting size of your penis larger or the size of your erection bigger than it was before, no. Pumps can increase the size of your penis if your penis has suffered some shrinkage from a condition such as Peyronie's disease or from severe erectile dysfunction. When men suffer from severe erectile dysfunction, they no longer get spontaneous erections in the middle of the night, and those tissues tend to atrophy. And using a penile pump can stretch it back out and restore some of that lost length. Whether or not a penis pump will make your baseline normal erection even bigger, I really can't comment because it's not part of the therapy I recommend, and I haven't really encountered any men in my practice who have told me that that indeed is the case. So I'm going to say probably not, or I don't know, but it can restore what has contracted.
All right, urologist Dr. Aaron Spitz, you've truly said it all. I don't know that that statement has ever been more true on the program. I really appreciate you talking to us today.
It's my pleasure, and if I can ever be of help with other questions down the line, feel free to give me another call.